Hey, my name is Michelle Patch of Patchworks Counseling. I'm a licensed clinical professional counselor, licensed social worker, and certified personal trainer through the American Council on Exercise. I want to take a minute to talk with you about the level of scoring you might receive in taking the Patient Health Questionnaire, or PHQ-9. The PHQ-9 is a multi-purpose instrument for screening, diagnosing, monitoring, and measuring the severity of depression. Scoring is anywhere from a 0 to a 27. A score of 0 to 4 indicates no depression. A score of 5 to 9 indicates minimal or mild depression. Scoring at a 10 to 14 indicates moderate depression. A score of 15 to 19 indicates major depression, moderately severe. And a score of 20 to 27 indicates major depression at a severe level. For this segment, let's focus on the 20 to 27 range of major depression at a severe level. Symptoms vary from person to person. Severe depression symptoms can be, but are not limited to, feeling distinctly depressed and irritable in your mood, a loss of pleasure or interest in things that you often did find pleasure in, decreased or increase in weight or appetite, decrease or increase in sleep, a disruption in your sleep patterns, appearing to feel to be slow, to be agitated, have that lack of motivation, feeling that fatigue and loss of energy, feeling sad, worthless, guilty, right? Hopeless, having increased worry or anxiety, experiencing poor concentration and really an inability to decision make or problem solve, and avoiding those usual activities that you've done in the past. Feeling like life may not be worth living, talking about death, having thoughts of suicide or attempting self-harm are all indicators of potential major depression. Episodes of major depression last an average of 6 months or longer. Sometimes severe depression can go away for a while, but it can be recurring. Treatment comes in a variety of different ways. Talk therapy in an individual or group setting, consulting with a doctor or psychiatrist about possible medication management for those symptoms, establishing a daily routine to help keep you moving forward, proactively creating a list of self-soothers like taking a bath, listening to music, or wrapping up in a warm blanket, going for a walk, and having that list ready to go of people you can call when you're in need. Exercising is super important. Moving your body at least 30 minutes a day and making sure that you're not sitting for any more than 60 to 90 minutes at any given time throughout that day. Learning to manage stress levels by finding ways to relax and be mindful. Developing those healthy coping mechanisms, mindful breathing, stretching, going outside, changing the environment you're in, engaging in enjoyable hobbies like gardening or cooking, snuggling with a pet, maybe, or calling a supportive friend or family member who might be able to help. Establishing a healthy, balanced diet is super important. Using and developing natural supports like helpful family and friends, and creating new social connections to help alleviate isolation, like joining a club or a group. If you're thinking about possibly exploring the idea of talk therapy, you're welcome to give me a call at 207-415-8784. You can call your primary care doctor for possible referrals, or check online resources such as 211maine.org or psychologytoday.com for a list of area therapists. If you're experiencing a behavior or mental health crisis or having unsafe or self-harming thoughts, please call Maine's confidential 24-hour, 7-day-a-week support and crisis line at 1-888-568-1112. And if you're feeling unsafe or in immediate danger, please call 911. If you have any questions or thoughts about the information you just heard, please don't hesitate to give me a call again at 207-415-8784. Thanks so much, and best to you.